In this week's muscle breakdown, I'm going to be talking about a very important muscle deep in the neck, part of the suboccipital triangle, better known as the Rectus Capitis Posterior Major, and it's a major contributor to neck pain, tension, and headaches. What's up, everybody? I'm Dr. Matt Maggio, creator of the Peak Method and founder of the Soft Tissue Revolution, where we show massage therapists how to easily double their income, all while working less, avoiding burnout, and being taken seriously as a healthcare provider. So in this week's muscle video, I'm breaking down a very important muscle that's very deep inside the neck. It is called the Rectus Capitis Posterior Major. Right next to it is another muscle called the Rectus Capitis Posterior Minor, and then to complete the triangle in there, you have the superior oblique. Now, these muscles get overworked, they get beat up with bad postures, and a lot of times they're contributing to a lot of unresolved neck pain, a lot of people that get tension headaches, even some migraines as well, because these muscles get overloaded. So what happens is we spend too much of our life kind of looking down at devices, sitting, not moving how we should, and these muscles get overworked and they get stretched. And when they get overworked and stretched, they develop scar tissue. Yes, I talk about scar tissue all the time, but scar tissue is like glue that gets inside the muscle, makes it really hard for the muscle to stretch and contract. So a couple things happen. When these muscles get really bad up here in the neck, inherently you want to kind of like jump forward to take some of that pressure off of there. But you can't walk around all day like this. So what happens is you pull back down through here. So when you do that pull back in there, it puts more pressure down on the lower area. So a lot of people that come in with tight traps, tight levators, and just a lot of dysfunction down in the shoulder, a lot of times there's a missed problem up there. So you keep treating in here, but the problem's really coming up from there. The problem with the suboccipitals are they're really hard to get to and they're really small. They're very small in their overall surface area, but they can cause a lot of problems and a lot of dysfunction in there whenever people are having unresolved neck pain. Another thing that can happen too is deep in there, in the fascia up there, and where some of the nerves come down, the greater occipital nerve and things like that, is those nerves can get caught in those suboccipitals too. So a lot of people that are coming in with migraine headaches, tension type of headaches, it's starting in there and those are getting jammed up, and they go to great lengths to try to get rid of that. They'll do like Botox injections, some awful medicines. But the problem is it's really a tissue component that can be in there and fixed to a good result. What happens is finding and then being able to fix these muscles are really hard because they're really deep. They're between a lot of tissue, and most practitioners aren't able to even get to them or properly assess them. So what I want to do first is show an advanced palpation from our Peak Method training to help you find the landmarks where these muscles are. Then you can go in there and actually palpate it and find it, because if you can't find it, you can't fix it. So we got through that upper cervical test and went through everything. Now we want to get into a more of an advanced palpation of the suboccipital muscles. This area is very problematic for so many people with bad postures, headaches, tension, everything like that. The problem is the muscles are really deep and a lot of practitioners aren't able to get an effective treatment. So the two muscles I'm going to be demonstrating today are going to be Rectus Capitis Posterior Minor that goes through here, and then Rectus Capitis Posterior Major that goes through here. Now these muscles are as deep as it goes, and there's a lot of things that you work through. So a lot of times when practitioners are working these muscles, they're actually working like the trap, semispinalis capitis, cervicis, splenius capitis. They're actually not able to get on there and get deep where it needs to be, because these muscles are deep and you got to work through a lot of tissue. So I'm going to demonstrate a couple tricks, a couple methods to get in there and do that. So we start. A really good way to get this is we start by having the patient actually come to the edge of the table here and have their head and their shoulders and T-spine rest right there. And what that does is it really allows this area to open up and give me access to everything like that without a lot of that tension. If we do it laying down on the table, we're gonna have to work through the trap, work through a lot of those things. So what I do to start is I bring the head back in just a little bit of extension. And the key on these muscles is landmarking the areas where you need to find. So we're going to check Rectus Capitis Posterior Major first, and it goes from the spinous of C2 all the way up to the occiput, and it kind of goes at like a 45-degree angle. So what I do first is I find that C2 spinous. It's pretty easy to find. And then what I do is I pick up my finger and go just a little bit lateral. Now I know I'm there because I landmarked it. And in order to get the depth that you need on it, a trick that I like to do is I take this bottom leg here and I put my arm right up against it. And then what I do is I slowly drop my body in. And that allows me to get some leverage. It's almost like I'm a fulcrum as I go up through there. So if you're struggling getting onto these muscles, get a little bit of extension and then drop in like that. And you should be able to, when it's done right, to hang out there all day. And it's a really easy contraction and my hands aren't getting tired at all. So I hope that palpation video helped. One thing that you're going to see, and I talk about it in there, is there's no way that you can actually get in and treat these muscles accordingly if the client is laying face down or they're sitting up. You have to have them on their back and then open up that space a little bit more. It'll allow you to get in there and open that up. Now, usually these suboccipital muscles are going to be a wreck on pretty much anybody that comes into your office or your clinic with neck pain. And I'm going to assure you that probably no one's actually effectively got in there and treated it. Now, these muscles are hard to treat because there's a lot of different components where you go in there. So I teach in my method all the time, there's two types of tension that you want to get on the muscle. One of those is just called internal slide, where you set it and the muscles come to you. And the other one is external slide, where you have to set it and go past that. Now, these muscles follow the rule of treatment of what's called external slide. So what I'll do is I'll link in a video from our training in the peak method that talks about the difference between internal and external slides so you can get a better idea. So I get a lot of people that reach out to me and they go, oh yeah, I do that type of treatment as well. You know, I might do some vibration treatment, some taping, some deep work on that, but that's not actually getting in there and getting to the root cause and fixing the problem. What you have to do is you have to first find the problem and know that it's in there, and that starts by watching that palpation video over and over again. Then number two is you got to get proper depth and then proper tension on that muscle and have the client go through a full range of motion. That is the only way you're actually going to break down scar tissue. This is why people struggle a lot, where they're not getting resolutions for their neck pain. They keep going back in there and checking out the trap, checking out everything in there, but they're not fixing up here. And if you fix up here, this is going to make things a lot better. So any of your clients with headaches, unresolved neck pain, get in there, palpate on this muscle, and you'll really find a lot of dysfunction in there and a lot of things that you can fix. So that's all I got for the video. If you like what you saw, drop a comment, a like, a share. Be sure to check out in the show description or the show notes below on YouTube, the link to the internal versus the external slide. If you got any muscles that you want us to cover or going more in depth, send me a message. I'm always here to help, and share this with other people that you know you can help. And lastly, if you want to get access to our peak method training and start getting taken serious as a healthcare provider, work less and make a hell of a lot more money, all the information to request that information is down below, and don't wait anymore. So I'll see you guys on the next one. Have a good day. Bye.